Liposuction versus a tummy tuck is the question. What is the difference? So that's really a good question. And liposuction, as I mentioned earlier, is a great tool for removing fat. There's a tube, which we call a cannula. It's got a hole on the end of it, and we place that underneath the skin to directly remove fat. It only addresses fat, and again, that's a limitation of this procedure. When folks come in and they're interested in a tummy tuck, usually they have problems with three different things. They have some fat, they have skin excess, or they have or they have muscle laxity, which is a diastasis. Your six-pack muscles, which run straight up and down your abdomen, starting from just underneath the rib cage all the way down to the pubic bone, can get pulled apart. And that can happen from obesity, from being heavy. Most commonly happens from carrying a baby to term. So the space in between these muscles, when it gets stretched out, is called a diastasis. And you can do sit-ups all day long, and you can do abdominal workouts to get your muscle tone back, but you cannot close a diastasis. A diastasis will not correct with exercise or any other measures other than surgery. So an abdominoplasty, or tummy tuck as we call it, is a procedure where we get rid of some of the extra skin, we get rid of some of the extra fat on the tummy, and we also tighten those muscles. There are variations on this, such as a mini tummy tuck, where we typically don't do muscle work if folks don't need that. There are other variations on it, which I won't go into for simplicity of this video, but I almost always do liposuction when I do an abdominoplasty. And I use it on most of my body contouring cases to transition the areas where we've done a surgical procedure to the adjacent area where we have not. So a good example of this is a tummy tuck. We might have a nice flat tummy, but for folks who come in, we might have a nice flat tummy after a tummy tuck, but for folks who come in and have extra fat on their side or flanks, love handles as they're called, we don't want to leave that. We want the whole trunk to appear nice and natural and anatomic. So what we'll often do is use liposuction with the tummy tuck to transition these areas on the side so that everything looks normal and natural and anatomic, as we say.